annual open enrollment period is almost here for Medicare and the Affordable Care Act, so we want to look at the numbers when it comes to health care in retirement. About 70% of all American workers have said that they are confident that they will have enough money to pay for medical expenses in retirement. However, in a recent survey of the same group, 30% of those workers that were close to retirement reported that they were not at all confident that they would have enough money to pay for their medical expenses in retirement. So Adam Bruno, the founder and president of Evolution Retirement Services, joins us live this morning to break down some of these numbers and what we need to know as we head into this. And I think we're all concerned, Adam, about paying for medical costs when we retire. How concerned should we be?
Well, Chris, and of course, thanks for having me as always. I think the answer to your question is we should be concerned, but I know that with proper planning, you can always plan away from these increase in dollars that you're going to spend. But, if you want to talk about the numbers, a 65-year-old couple is going to pay around $11,369 for the year right now. But in the future, that number will actually increase to $39,208 for the year. So monthly cost-wise, it's going to jump from $947 to a whopping $3,267 a month, as of right now in today's numbers.
Wow, that is amazing. That is a lot of money. How are people going to be paying for this, and do we really expect that they'll be able to when they retire?
Well, Chris, the big thing is, I can't stress it enough, you have to have a plan, especially when you talk about health use services. And there was a study using 70 million actual cases. At age 65, you can expect a health care premium to add up to $321,994 over their lifetime. If you include dental, vision, copays, out-of-pocket costs, that's $404,253 that rises to. And for a healthy 55-year-old couple who plans to retire in a decade, that number jumps to $498,000 and some change. And to answer your question, the most important thing we can do is remember that that's of right now. Now, does that mean we're going to end up paying that money? Who knows? There could be regulatory changes. There could be changes to the tax laws, things that can affect us. The biggest thing we can do, though, is plan and prepare, right? That's the most important thing.
Well, those numbers are so daunting. What can we do to prepare?
The biggest thing is it could be setting aside a little bit more in retirement. It could be adjusting those numbers for inflation and future costs. Remember, that's what we see is a clear picture right now. We don't have a crystal ball. We're just looking at based on today's dollars. The Affordable Care Act, it was a great idea, right? But I think we can all agree, anyone who's shopped for insurance can see those prices right now. If you're a middle-class American family, it's expensive. So, I mean, in my mind, I would expect it to only get better. But you have to sit down with somebody, even if it's not me. At Evolution, what we do is we plan for these things based on a whole retirement approach. That's why we're not Evolution Financial Advisors or Evolution Retirement Services.
Okay.
But even if it's not me, the most important thing you can do is catch it early and sit down with somebody. And they will tell you, maybe you need to set aside an extra 5%. You never really know.
All right. Thank you very much. Always bringing some cheerful news for the holidays, Adam. Thank you very much. So he's right. You do need to consult with someone. If you'd like to consult with Adam on your upcoming retirement, you can contact him here, Evolution Retirement Services. The number is there on your screen, and so is the address.